That uproar over Planned Parenthood. Undercover videos secretly taped by anti-abortion activists have raised questions about the group's ethics, reignited the debate over federal funding, and Planned Parenthood's president is here live for her first interview since the tapes came to light. After this from ABC's David Wright.
We've been very good at getting cars on liver.
It's a hidden camera sting of the most influential abortion rights group in America. Two videos that purport to show Planned Parenthood officials callously over lunch discussing selling parts of human fetuses.
Yeah, liver is
huge. Lower extremities too, which that's simple. I mean, that's easy.
The man off camera is David Daleiden, an anti-abortion activist who claims Planned Parenthood is trying to make a profit from the abortions it performs.
Bottom line, Planned Parenthood's sale of aborted baby parts is about money and is about soothing their consciences for the late-term abortions that they do.
Planned Parenthood denies that, even on the video, insisting the prices are only to cover costs.
Nobody should be selling tissue. That's just not the goal here. This is a way to offer patients a service that they want, do good for the medical community.
The group also alleges the videos were selectively edited. That said, Planned Parenthood officials have apologized for the lack of compassion shown on the videos, which have set off a firestorm.
This video and the one from last week are both gruesome.
Republicans in Congress are opening two separate investigations.
I could talk about the video, but I think I'd vomit.
Many Republicans calling to cut all federal funding for Planned Parenthood. Democrat Hillary Clinton defends the group, dismissing the videos as a smear campaign.
It's really an attack against a woman's right to choose.
There may be more bombshells to come. Daleiden says he has more videos in the works.
There's going to be at least 10, possibly a dozen more videos to come over the coming days and weeks.
The abortion rights group has weathered plenty of tough fights in the past. The question now, can they withstand this? For this week, David Wright, ABC News, New York.
And Cecile Richards, the president of Planned Parenthood, joins us now. Thank you for joining us this morning. You just heard David say right there, 10 to 12 more tapes coming. Are you worried about what they're going to show?
No, in the sense that, of course, this has been a 3-year, well-funded effort by the most militant wing of the anti-abortion movement in this country to try to entrap doctors, and of course, highly doctored videos which show absolutely, doctors repeatedly said, it's all been edited out, Planned Parenthood does not at all profit from fetal tissue donation, which is an important element of healthcare research in this country. I think what's not told is that, of course, these are highly selectively edited. The folks behind this, in fact, are part of the most militant wing of the anti-abortion movement that has been behind, the bombing of clinics, the murder of doctors in their homes and in their churches. And that's what actually needs to be looked at.
But you have apologized for Dr. Nicotolo's tone.
Correct.
In the statements. Reports that she's been reprimanded. So have you spoken to her and the other staff member, Mary Gatter? How have they been reprimanded? They've
been reprimanded for their tone, absolutely. But what I want to really make clear, George, is Planned Parenthood has broken no laws. We have the highest standards. The care and health care and safety of our patients is our most important priority. In fact, Planned Parenthood has, for 99 years, been one of the largest nonprofit healthcare providers of women in this country. 1 in 5 women in this country depend on Planned Parenthood for health care, more than 2.5 million people every single year.
You say that no Planned Parenthood affiliate has profited from fetal tissue.
Correct.
But do you know how many clinics harvest this tissue and how much money they receive?
Very few. I mean, it's only a handful of states where fetal tissue donation is happening. But let's put this in the bigger context, George. This is actually not about women's health care. These activists don't care about that.
When you say very few, what are we talking about?
Less than 5. Less than 5. And so this was not actually an effort to undercut, to discover any problems. It's actually an attempt, a 3-year effort to entrap doctors. They were completely unsuccessful, and so now they're usually using these very highly edited videos, sensationalized videos, to try to impugn and smear the name of Planned Parenthood. They have zero credibility. They set up a fake company. They apparently used fake government IDs. They fake tax filings and completely falsified what they were about.
I take your point that the videos they put out are heavily edited, although the entire videos have been available at this point. But
in that longer video, the doctor repeatedly says more than 10 times Planned Parenthood does not ever profit or do any of this for profit.
But they also show one of the doctors, Mary Gatter, appears to be haggling over the prices.
Not.
I just want to show that right here.
If it's in the ballpark, then that's fine. If it's still low, then we can go. I want a Lamborghini. I said I want a Lamborghini.
Don't we all, right?
Exactly. But if there's no financial benefit to the clinics, why are they haggling over the cost?
They're not. The only people that are haggling in these videos are the undercover folks who are absolutely trying to entrap doctors, and they were completely unsuccessful. That's why they're showing these highly edited videos to be sensationalized.
When you see something like that, what do you think?
It's completely taken out of context. We have, at Planned Parenthood, we serve 2.5 million people every single year. Women come to us for the vast majority of care. They come to us for breast cancer screenings, cervical cancer screenings, birth control. 1 in 5 women in the country have been to Planned Parenthood for health care. I myself went there for birth control. Half of our health centers are in medically underserved communities in America, places like Lancaster, Pennsylvania, where women come for their basic well-woman visits. And that's actually what's at stake. This entire effort is a complete political smear campaign in order to cut off funding for basic health care for women in America at Planned Parenthood. And I think one other thing is really important to understand. We do more at Planned Parenthood every single day to prevent unintended pregnancy than any organization in the country. We have for 99 years, and I stand behind our clinicians and our doctors who provide compassionate care every single day in America, despite harassment.
The Washington Post columnist Michael Gerson has pointed out that charging a fee for this material doesn't...
It's not a fee. It's not a fee. It's actually just the cost of transmitting this material to research institutions.
But that does improve the finances of the clinic, doesn't it?
Absolutely not. Absolutely not.
Because
in fact, George, it's really important. They have repeatedly tried to entrap doctors. I mean, we've now seen, that they repeatedly say, "Wouldn't you do this for money?" And the doctors say, "No."
So no financial benefit at all. But STEM Express, which is one of the companies you work with, they have a brochure where it talks about the financial profits, the financial benefits.
STEM Express is a for-profit company. That's not Planned Parenthood. We are a 100% nonprofit company.
But it talks about the financial benefits to the clinics.
Well, there are no financial benefits to the
clinic.
Absolutely. Absolutely. And we're happy. Look, we look forward to the facts coming out. We should not base any kind of decisions about healthcare in this country based on highly sensationalized folks who are nothing but militant anti-abortion extremists. This is part and parcel of a much longer campaign over many decades to try to end access to legal abortion.
The second issue they raised, the tapes appear to describe times when the clinics adjust the abortion procedure to better harvest.
It's not done.
The fetal organs.
It's absolutely not done. And I've talked to doctors all across the country. And look, we're totally open to...
But it does appear that that's what's being described in these tapes.
Well, it's because these tapes have been edited and they've tried to entrap doctors to say things. And listen, I stand behind the health care that we provide at Planned Parenthood. Women trust Planned Parenthood. And I look forward to anyone who wants to look into our policies and procedures. I mean, we've said that to Congress. The facts are on...
But when these doctors are talking about it, and this gets graphic, but they're talking about less crunchy ways to perform these abortions so that the organs can be preserved, what's happening? Are they just lying?
No, that's absolutely... All of this is taken out of context. What happens in this country at Planned Parenthood and other hospitals is that women in a very few places are allowed to donate fetal tissue for life-saving medical research. Research that is, developing cures for Parkinson's and for Alzheimer's, even the Ebola vaccine. To me, this isn't something that actually should be criticized or made fun of. This is actually laudable that women and their families choose to make fetal tissue donations in order to potentially save lives of other folks. And I think...
As long as the procedure is never altered, and you're stating that unequivocally.
That's right.
Any other reforms Planned Parenthood is going to take in the wake of this?
Well, obviously, the most disgusting part of this to me is that these folks lied to gain access to clinics. What doctors and clinicians face to actually provide health care to the women in this country is already pretty incredible. But I think it's really important that the safety and the health of our patients and the women that we provide care to is essential, and we take that first and foremost. That's the most important thing. These activists, these militant anti-abortion activists, on the other hand, do nothing to improve the health and safety of women. And if they had their way, women could no longer come to Planned Parenthood for birth control services, for breast cancer screenings, for cervical cancer screenings, or any other health care.
Cecile Richards, thanks very much for your time this morning.
Thanks, George.